While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body podcast. Today, we have with us a very special and well-known guest, Dr. Darin Ingels. He's a licensed naturopathic physician, author, international speaker, and leading authority on Lyme disease. He's a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, and natural therapies worked with his body to heal instead of against it. He then applied what he learned about his own healing journey to his own Lyme patients and found they recovered faster and with less side effects. Dr. Ingels has now treated more than 8,000 Lyme patients using his novel approach, many who have gone on to live healthy, symptom-free lives. Dr. Ingels has been featured on WebMD, Mind Body Green, Be Well, Thrive Global, Motherly, and Dr. Ron Hoffman's Intelligent Medicine podcast, and is the author of The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. Welcome, Dr. Ingels.
Dr. Tim, happy to be here.
Yeah, so I was telling you before we started recording, I followed your work for a while. And how long have you been practicing? Let's start with that.
I am going into my 24th year.
Awesome. So, I was just going to say, I think you're 29 and holding. It's all that functional medicine, biohacking. But when you first started practicing, did you set out to treat allergies, asthma, and chronic pathogens?
Well, after I finished residency, I got very interested in environmental medicine, and literally, I think I was 2 months out of residency, and I went to my first American Academy of Environmental Medicine conference. And of course, environmental medicine is very much part of our training as naturopathic doctors. So I had been fortunate that one of my teachers was Walter Crinion, who is very well known in the environmental medicine world. Unfortunately, he passed away a few years back. But, when I went to AEM, I got to sit with all these doctors, MDs, DOs. In fact, I think I was the only naturopathic doctor at that conference.
Right.
It was so cool because, here were like-minded people who really understood the importance of how the environment impacts health. And really it applies to everything in health. I mean, so whether you're, a naturopath, chiropractor, MD, DO, physical therapist, it doesn't matter because there's some element of the environment that's influencing our health. And it's everything from allergies to asthma to heavy metal toxicity to mold to chronic infection to chronic gastrointestinal problems. And so I just saw how this really fit with my naturopathic training. And from there, I moved to Connecticut. I had trained in Seattle, and I was fortunate to get to work with a naturopathic doctor who did a lot of work with allergies and immunotherapy. And so I got to train with him before he retired. And so that was really kind of the background for me. So I'd already doing a lot of work around, allergies, asthma, eczema, typical allergic kind of symptoms. And then I got Lyme disease myself. Of course, living in Connecticut, I lived, 30 minutes down from Lyme, Connecticut, which is named after. And, it took me 3 years to get my own health back from Lyme. But even realizing for having chronic infection, it tends to tilt the balance in the immune system. And I see a lot of people that after they get not just Lyme, but chronic infection, they become more hypersensitive to their world. So I still was able to draw my background in environmental medicine because it's still a key part of getting people over, chronic infection. So it's really just been kind of the culmination of, now 24 years of clinical experience, obviously treating a lot of Lyme patients, but really, environmental medicine's become really the backbone of my practice.
Awesome. Well, thank you for that. And I agree with what you said. That's why I got out of, as a doctor of physical therapy, I was doing orthopedic rehab. But what I noticed is that a lot of people coming in, they would have tenderness to palpation, their entire body. So that's, red flag for something systemic. And a lot of times joint pain, as you know, is an external manifestation of an internal problem. And when you look at the studies on patients with bilateral knee pain, in the synovial fluid, you see mycoplasma antigen antibody complexes.
Right.
And so the environment, no matter what field you're in, if you're a psychologist, pharmacist, now it seems like common sense. But I remember 12 to 15 years ago, saying that your environment impacted, whatever health imbalance you had was like revolutionary. No, that can't possibly be true. But have you seen that turn sort of take place in the naturopathic and the allopathic communities?
Well, I think one of the things that has become very apparent in the years of clinical practice is that we you and I both studied functional medicine, so I think one of the key elements of that is really understanding the terrain. And I think this is where allopathic medicine misses the boat a little bit, and where you and I are probably more on the same page of this is that if you look at, again, all these external things that influence health, whether it's a toxin or an infection, why does it impact some people so profoundly and other people it doesn't bother them at all? I mean, think about coffee, right? I mean, there's the person that can drink a sip of coffee and they get nervous and jittery and they can't sleep for days. And there's the other person that can drink a pot of coffee and it doesn't bother them at all. So to a degree, I think, there's these underlying genetic dispositions. But beyond that, I think when we talk about the terrain, that's really important of understanding the individual, because that's what dictates your disposition towards any chronic illness. So, that's why, when you and I are sitting down with our patients, we're going through this very long list of all these things that we think are impacting your health. And it's very individualized. I kind of laugh now when someone comes in and asks about what's the protocol. What's the protocol? I'm like, well, I mean, the protocol is your protocol.
Right.
There's not really one protocol that we apply to everybody. Even if you got, 10 patients with Lyme disease or 10 patients with migraines, they might all be treated a little bit different because we're trying to understand your terrain, your environmental exposure, your uniqueness, because that's what makes you unique, right? I mean, that's what makes
Absolutely.
you. So, in terms of the bridge between allopathic, naturopathic medicine, I think if you look at medicine as a whole, we're starting to bridge that gap a little bit closer, but we're still really far away. I mean, allopathic medicine still comes from very much a disease-based system. I mean, I don't know too many people that go to their medical doctor when they're healthy just to say, hey, doc, what can I do to stay healthy?
Right.
They come to you and I for that.
Right.
But we're still a little bit of ways, I think, of bridging that gap. And it's encouraging, again, when I go to functional medicine conferences, environmental conferences, to see more allopathically trained doctors coming and interested in that. And in reality, I mean, everything in medicine has its place, right? I mean, if you break your arm, please don't come to me.
Right.
Come to me after the fact. I can help with healing and all that, but please go to the ER, get it fixed, and so forth. So allopathic medicine, when it comes to heroic medicine, is exceptional. But when it comes to chronic illness, I think there's a lot of deficits in conventional medical training that you and I are a bit more suited to address. So it's just one of these things where I think you got to take everything with a grain of salt, but it's not an either or. I mean, most of the patients that come to see me, they have their medical doctor, they have their primary care doctor who does that stuff. they have me, and they have their chiropractor, and they have their acupuncturist, and they have their osteopath. And so, we all have our place in medicine, but ultimately, we have to figure out how we combine all this to give the best outcome for each person.
Absolutely. I know you work a lot with patients and clients with allergies and asthma. What are some of the underlying causes of those conditions? And have you seen a trending increase in the past few years?
Yeah, absolutely. I mean, I think, if you look, internationally, allergies, asthma, a lot of these, what we call atopic diseases, they continue to increase. And I think it's a function that our world is just getting more toxic. And we know that from the research that there's a 3 generation transmission of a lot of these toxins. So when you have a child that has eczema or asthma, it's not just what the child's been exposed to, but it's what the parents and the grandparents have been exposed to that are also influencing that child's, symptom picture. So, we kind of have to intervene like now to help influence those future generations. But, it's a combination, I think, again, of, genetics, I think definitely plays a certain role. We know that if, one parent has allergies, there's a 20 to 30% increase in allergy in the child. If both parents have allergies, that goes up around 80%. So definitely a genetic disposition to being an allergic person. Beyond that, I think, early exposure, probably even in utero when mom's pregnant. Obviously, what the child's exposed to after birth, that includes food introduction, what mom's eating when she's breastfeeding. Of course, where you live in the world makes a difference. I think it's different if you live out in a farm community where you might be exposed to pesticides and herbicides, or even people that live in very urban places like New York City where you get, petrochemicals and other toxins just from pollution in the air. I mean, I live outside of Los Angeles, so we always get, red alerts of, bad air quality. So certainly that has an influence. And of course, if you live in a moldy home, that has influence. So all these external factors, again, generationally seem to, I hate to say make people weaker, but it almost kind of feels like that. It's like our immune system aren't as resilient as they used to be. I work with a lot of patients in Europe where, these buildings are hundreds of years old and mold is everywhere. And we don't necessarily see the kinds of problems there that we see here in the US when people have exposure to mold. So again, what's the difference? And again, it kind of comes back, I think, to the terrain theory that we're addressing all of that. But the fact that we've got so many environmental exposures, I mean, consider the average American gets exposed over 80,000 chemicals a year. And less than 200 of those have actually been studied for their safety. So, we live in chemical soup, and every day you're exposed to, chemicals, you're exposed to, hundreds, if not thousands of different germs, and all of that can certainly dispose someone to being more allergic or having asthma.
Yeah, so what you mentioned in terms of weakening the immune system, does that speak to the concept of allostatic load, the total stress load on the body and
Yeah,
its resiliency?
absolutely. We're all born with a barrel, and some people have a huge barrel and some people have a shot glass. And when it overflows is when we become symptomatic. So that's why we're always trying to reduce that load in the barrel. And again, some of this can be genetic, but this is where we kind of go top to bottom. It's like, make sure everything in your home is clean. You're using non-toxic chemicals, you're using non-toxic, detergents and soaps and shampoos and all these kind of things. Stop using Glade plugins, which is basically just shooting formaldehyde in your home. Don't use, Roundup around the home. Glyphosate is extremely toxic and it's completely pervasive in our food and water supply. And just about everyone in the world now has some element of glyphosate. So, controlling those kind of things that we can, I think makes a difference. Eating organic food as much as possible. And I think fortunately, back in the old days, organic food, was horribly expensive. And for a lot of people, it just wasn't financially feasible. But gosh, the 2 largest retailers of organic food, I think, are Costco and Target or Walmart. So, you can go to a lot of these places and get, reasonably cost organic food that lowers your load. And so again, it's just go for that low hanging fruit, go for the
Right.
things that are fairly easy to adopt in your life. And then beyond that, then you can start getting in more advanced kind of treatments to control your immune system. But so much of this is really just about, look around your home, control what you can, stop using toxic stuff, eat good, clean food, get off junk food, get off fast food, get off processed food. And it's amazing how much better people feel
Mhm.
uh, just by doing these relatively simple things.
Can you speak to the concept of tilt or toxicant-induced loss of tolerance and how that plays a role?
Well, till toxin-induced loss of tolerance, I mean, a lot of it comes down to these things called toll-like receptors, and there's, I think, 4 or 8 of them. And these toll-like receptors are basically kind of the on-off switch in your immune system. And so, for reasons that are beyond my knowledge base, but when you get exposed to different toxicants, they basically can switch these switches on and off. And when the switch gets flipped on, then your basically tolerance to whatever that thing might be starts to get lost. It's amazing. Every time I study the immune system, I realize how little we really understand about it.
Right.
And so I think there's a lot more than we know. I know from like animal studies, like if you want to do a study on food allergy, the
Mhm.
way you sensitize the rat is you break its skin and you introduce the food antigen through the skin, and that's what makes the rat allergic to the food. So it's kind of interesting. It's like, boy, we talk so much in functional medicine about leaky gut.
Mhm.
How much of it is leaky skin, leaky brain, these other leaky tissues where these barriers aren't protecting us the way they're supposed to. And it may be that as those barriers break down, that allows these things to pass through, and that now sensitizes our immune system. And then we've got these other part of the immune system called dendritic cells, and dendritic cells are also really important in sort of conveying information to the immune system about what's part of your world and what's not part of your world. So it's complex beyond, I said, what I understand about how the immune system functions. But I know that these toll-like receptors uh, play an important role in controlling, understanding what's part of your world and what's not. And a great example of that is gluten. I was talking to Dr. Tom O'Brien about this, and it's really interesting is that when you eat gluten, and this is everybody in the world, these toll-like receptors get activated and everyone gets transient leaky gut. But for most people, it's transient, then kind of closes up and you're fine. But there's that other percentage of people where it opens up the gut and it doesn't close. And therefore, you start getting, celiac disease, or what they call non-celiac gluten enteropathy, which is still kind of like celiac, and you still have a bad reaction to gluten. But it's just kind of curious that this happens to everybody,
Right.
and why. So, obviously, our immune system has a wisdom that's beyond our understanding, that it knows how to recognize what's part of our world and what's not. But there's those things that seem to change it again, that flip that switch on and don't quite flip it off. And I think about peanut allergy and how, again, common it is in the United States. And you look at a country like Thailand where peanut oil is used everywhere, and yet peanut allergy is virtually unheard of.
Mhm.
So is it that having more exposure, especially because, parents eat this, I mean, moms eat this when they're pregnant, this goes back many generations, does that basically block that, or does that keep the immune tolerance moving on? Um, I mean, I think we could argue pretty easily that the food supply in the United States probably isn't as good as other parts of the world.
Right.
All the chemicals, I said, pesticides, herbicides, we irradiate food, we genetically modified food, we hybridize food, we tweak food a lot. And, I always tell my patients, I'm like, look, if you ever go to the grocery store, you want to shop the perimeter of the grocery store because that's where the real food is. Everything in between is just kind of junk or filler food. So that should be a pretty limited part of what you're shopping for. But as a whole, again, we've got a problem with the quality of our food, and again, that's probably just another factor that disposes people to being more hypersensitive.
Yeah, absolutely. And in terms of treatments for allergies and asthma, and we can separate the two if you want. Obviously, allergies are not an Allegra or Zyrtec deficiency. What are some of the treatments you use in your clinic to help with those conditions?
Well, first and foremost, I mean, it's always looking at the gut. We know that the gut's responsible for up to 80% of your immune function. And again, if you've got leaky gut and these large proteins are passing across, that can dispose certainly something like food allergy. But again, even if you've got gut issues, it can make you more disposed to respiratory issues, chronic runny nose, asthma, eczema, these kind of things. So, making sure that someone has solid gut function. And unfortunately, we don't really have great tests for leaky gut. I mean, there is a lactulose mannitol test that we hardly don't use much anymore. A lot of it's a clinical diagnosis, but making sure that you're having healthy elimination, you're going at least once a day, if not twice a day. It's well formed, has the right color. That tells us a lot about your gut health. So that's sort of the foundation. If you're chronically constipated, chronic diarrhea, chronic mushy hard stool, that tells us that something in the gut isn't functioning well, and we need to kind of fix that first, because everything else we do on top of that won't be nearly as successful until we know that your gut functions well. So gut definitely is number one. Number two, like I said, it's environmental control, using high quality air filters, using good quality water filters, making sure your home is safe, you've got it as clean as possible. Look, when you walk outside of your home, I mean, it is what it is. There's very little you can do to control the outdoor air quality, but you can at least control your indoor air. And again, that lowers that load in your barrel, makes it less damaging to your immune system. And then beyond that, we can start getting into different types of immunotherapy. And, most people, if they've heard of immunotherapy, they think of like allergy shots. So if you go to an allergist and they find out you're allergic to dust or ragweed, they'll say, okay, come in every week and we're going to give you an injection of dust or ragweed. So they're actually injecting you with the thing that bothers you, but they start you in just a teeny tiny amount. And then each week they kind of increase the dose as you tolerate. So this is a way of, escalating the dose to build your immune tolerance or rebuild it again, and eventually get to a point where you're on a maintenance dose. And then over time, hopefully, again, if you're allergic to ragweed and it's ragweed season, you can be outdoors without wanting to rip your face off because your eyes are itching, you're sneezing, and you're coughing. But we can do that for really any number of different antigens. Now, in the conventional allergy world, they really only do allergy shots for environmental allergies: mold, pollen, dust, cat, dog, feather, things of that nature. They really don't touch food allergies with the 10-foot pole. If you've got a true food allergy, anaphylactic, they say keep an EpiPen on hand, and then, stay away from the food. There are some clinics now that are doing what's called oral immunotherapy, where like if you're allergic to peanuts, you'll come in on periodic basis and they'll give you little bits of peanut and they monitor you very closely in case there's an allergic reaction. And then again, they build up your dose over time and eventually get to a point where, again, you can eat peanuts on a regular basis and, you don't have this anaphylactic reaction anymore. But in our world, I mean, we don't do allergy shots like that. And I don't do the oral immunotherapy because that has to be in a different kind of controlled environment. But we've got other ways that we can control your immune system. So one of the ways is called LDA, or low dose allergy therapy. And LDA has really been around since the 1960s. There was a doctor in the UK. He was an ENT surgeon named Dr. Len McEwen. And very long story, but he kind of found out by accident that if you use highly diluted allergens, so in conventional allergy, they use 1 to 100, 1 to 1,000 dilutions. That's what they're injecting you with. And he started using 1 to 10 million, 1 to 100 million on up. So way, way, way more dilute. And he mixed it with an enzyme called beta glucuronidase. And we found this enzyme, and this is an enzyme that your body makes. It's naturally found in your white blood cells, but it seems to have this immune modulating effect. So if you mix the beta glucuronidase with ragweed, with dust, with mold, with whatever, that it would actually help build your immune tolerance, much in the same way that allergy shots would. But allergy shots do have a small risk of having an anaphylactic or an allergic reaction to the injection itself. And because these are so highly diluted, we really, I mean, as far as I'm aware of, there's never been a report of anaphylaxis from doing LDA. So Dr. McEwen taught it to do it as an intradermal injection. So it's only about a drop and you just inject it underneath the skin and you get a dose every 7 weeks. So unlike allergy shots that usually do weekly, this is a little bit more convenient because it's only every 7 weeks. And then Dr. Butch Schrader, who's a United States doctor, he had trained with Dr. McEwen. He was bringing it over from the UK. And at some point, the FDA kind of got a bug up their hindquarters about importing from the UK. They put the kibosh on that. So it used to be called EPD, or enzyme potentiated desensitization. And then when Dr. Schrader brought it to the US and couldn't import EPD anymore, he worked with the local pharmacy or a pharmacy here in the US and had to rename it something else and called it LDA. So LDA and EPD are the same thing, really. It's just here we call it LDA. So LDA is nice because really there's not even testing involved because we base it on your clinical history. If we know that, spring pollen bothers you, or every time you go into a damp basement or it's humid outside, you get reactivity, or we know certain foods bother you, then we just, give you the doses. So there's different mixes. There are actually two food mixes. There's what's called a median mix and a high mix. There's an inhalant mix, which has mold, pollen, cat, dust, dog, feather, pretty much anything you breathe in. And then there's a chemical mix for people who are chemically sensitive. They know that scented candles and petroleum and these kind of things bother them. So Dr. Vincent, Dr. Ty Vincent, who had been doing LDA in his practice, had been doing it very conventionally, started experimenting and said, well, what happens if you do it under the tongue instead of doing it as an intradermal injection? And found it actually worked about the same. We've been doing in our practice as a sublingual or under the tongue. We rarely do the intradermal injection anymore. The intradermal injection, by the way, really hurts. It feels like you're getting stung by 1,000 bees. It only lasts for about 30 seconds, but it's pretty painful. But we find that the majority of people can do it under the tongue. They do fine. There may be a small percentage of people that do need the intradermal injection, but most people can do a sublingual. So again, it's safe for anyone, whether it's a child or an adult. We even use it for people that have legitimate anaphylactic reactions to food. And we do see some people, it does help reduce their reactivity to that particular food because they'll get retested by their allergist and they're not as reactive, or sometimes the reaction goes away completely. So LDA, again, is just, it's reasonably cost effective, it's safe, and clinically it's effective. I'd say if there's a downside to it, the downside is that it might take several doses before you really feel a difference in your allergies. So because you're getting a dose almost every 2 months, it may be that third or fourth dose before you really feel like your allergies are better controlled. And if you start any kind of immunotherapy during peak allergy season, you're going to see less effect of it. So if you're starting in the middle of, tree pollen season and you know that trees bother you, it may not be really till the next season before you really feel that difference.
And what's the difference between LDA and LDI for listeners?
So LDA, so Dr. Vincent kind of muddied the waters on this, but LDA typically refers to traditional allergies: food, mold, pollen, cat, dust, dog, feather. LDI, when it first came into inception by Dr. Vincent, again, maybe it's been years now, really specifically referred to microbes. So we know that your immune system can treat microbes much like an allergen instead of a pathogen. It engages a completely different part of your immune system. And we know that a lot of microbes have this disposition to causing autoimmune type illnesses. So you mentioned mycoplasma earlier causing joint pain. That's an example of mycoplasma causing an autoimmune reaction. We know that Lyme disease can do this. It can affect the brain and the nerves and the joints. Strep is a classic autoimmune, causes rheumatic fever, rheumatic heart disease. This is an autoimmune reaction to the bug. And if you go into the literature, there are literally thousands of studies showing how different bacteria and viruses, parasites, fungi can cause autoimmune disease. So the idea behind this, and what Dr. Vincent realized, is that your body often treats these microbes like an allergen. So if we can use LDA to treat mold or pollen, why can't we use the same concept to treat the autoimmune reaction that these bugs create? And so I think Dr. Vincent started with strep. That was the first thing he used. And the strep is dead. It's been irradiated. It's killed. It can't cause infection. It can't reproduce, but it contains all the little bits of the bug that the immune system needs to help modulate its reaction. And again, same thing, you dilute out the antigen like you do LDA, you mix it with the beta glucuronidase, you put it under the tongue. And then he found that, I can't remember the specific case. I think it might've been a joint pain problem, but whatever that patient had, it went away after he gave this dose. And then from there kind of grew of, looking in the literature, okay, what's the connection between these other bugs and different kinds of illnesses? And now we've got, I don't know, 40, 50, 60 different, microbes that we've identified that are connected with different conditions. So we know that something like psoriasis has an association with either staph or strep. And of course, Lyme disease, I use a lot of LDI for Lyme because it gets associated with causing joint pain and brain fog and headaches and neuropathy. And again, it's a pretty long list. So, you know, Dr. Vincent has changed his practice a little bit, that he now has created his own food antigens and environmental antigens. So he calls everything now LDI. So depending on who you're talking to, in my world, LDI is really more specific for microbes. LDA is for conventional allergens. I know, and if you watch any of Dr. Vincent's videos, he refers to everything as LDI. But the concept behind it is the same, is that we're basically using highly diluted substances as a way to modulate the way your immune system is reacting to any of these different either allergens or potentially pathogens.
When you're dealing with a pathogen like Mycoplasma or Lyme or HHV6, how do you know when to stop killing and playing whack-a-mole with the bugs and modulate the immune system? Can you start LDI while you're killing?
Yeah, it's a good question. I mean, often we're doing both. I mean, in my world, it makes sense to me is we always start with some element of antimicrobial. So in my practice, I use herbs. I almost never use antibiotics. So I'll usually have people on herbs for 4 to 8 weeks. Let's bring the load down. In my mind, if you are reacting to, let's say, strep, and if there's a million strep in your body and we can bring that down to 1,000 or 10,000, well, there's less stuff to irritate your immune system. So I think, we can use herbs, or if you're using antimicrobials, antibiotics, using that first to bring the load down makes sense. I also found that if you start someone on antimicrobials and LDI at the same time, it's really kind of hard to know what's helping, what's not. And with LDI, it's very important we understand how you react after the dose, because that dictates, do I need to give you a stronger dose? Do I need to give you the same dose? And it really just kind of muddied the waters and made it confusing. So now I'll start people on antimicrobials, as I said, for 1 to 2 months. And then after that, then we'll start getting into the LDI. If it really is just the infection itself and you kill the bug essentially, symptomatically, you're going to get a lot better. When I see people who are on antimicrobials, herbs, or antibiotics for long term, and they're not improving a lot, it makes me wonder at that point, how much of it's really infection and how much is really autoimmunity? Because my experience is that often when we start LDI, once we get the right dose, then the symptoms really start to change and they feel a lot better. So, I think COVID was a great example of this. The virus itself really wasn't the problem. It was the immune reaction to the virus that made it potentially
The
lethal.
cytokine storm, right?
Cytokine storm. So that's the immune reaction. I mean, theoretically, and I wish there was a way to prove this, but I kind of, they always talk about the immune suppressed being so vulnerable. And I kind of wonder if that's true, because if you're truly immune suppressed and you don't make this robust immune response, well, you're not going to have cytokine storm, right? Because your immune system doesn't do that. So the virus itself, it doesn't create the damage. It's the immune reaction to the virus that creates the damage.
Right.
So I think that's true for a lot of these bugs that we're treating. It's the immune response to the bug that creates the symptoms. So again, if you lower the load, there's less stuff to irritate your immune system. Therefore, symptomatically, you might feel better. But yeah, when you get to that point where even on antimicrobials and you kind of hit a wall and you're not improving, that's definitely a good time to try LDI.
What's the relationship between mold and asthma?
Well, mold is a major trigger for asthma. If you think about asthma as a whole, asthma is basically an allergic reaction of the lungs. There are other types of asthma. There's, exercise-induced asthma. There's cold-induced asthma. There can be other things that aren't necessarily allergy. But I think the majority of people with asthma have some element of allergy that underlies it. And mold, like any other type of allergen, can be a trigger. I think what makes mold potentially more problematic is that if you live like in a water damaged building, then you can also get mycotoxins. So there are certain species of mold. So mold spores by themselves can trigger an immune reaction in your body that you become allergic to mold spores. So every time there's mold spores in the air, you can react. But in a water damaged building, certain species like Stachybotrys, like Penicillium, like Aspergillus, can create these mycotoxins, which are chemicals. And if you breathe in these chemicals, I mean, much like breathing in gasoline or something else, it's noxious, it's toxic to the body, and it can directly damage the lung. And it also becomes an immune suppressant. So the combination of mold allergy and mycotoxicity, if you're someone with asthma, it's kind of a 1-2 punch where it's suppressing your immune system, it's making you more susceptible to infection, because the nature of asthma is that you get mucus buildup in your bronchioles and you get constriction. But if you get that mucus buildup, I mean, that's a good breeding ground for really any pathogen. It could be bacterial or viral. So, part of treating asthma is that we're trying to clear up that mucus and open up the airway. But mold is just one of those things that, boy, it can just really make people's asthma so much worse. And if mold, if you're living in a home that has mold, I hear people tell me this all the time when they go on vacation, they go visit someone else, particularly for a prolonged period of time. Oh my gosh, my breathing's so much better. I don't get headaches anymore. My energy's better. And then I got back home and man, everything just kind of came back. I'm like, well, that's pretty telling that your home's got something toxic in it, and more than likely it's probably mold.
Absolutely. And so you see in your patients, or do you see in your patients when you're treating allergies, if someone also has asthma, the asthma may indirectly improve?
Absolutely. I mean, ultimately we're doing the same thing, right? We're trying to reduce that load. We're trying to modulate the immune system. And for someone who has allergies and asthma, we really do the same kind of things. There might be a few little things we do a little bit different with asthma. There's some other specific treatments to asthma. We'll use like nebulized glutathione.
Mhm.
Magnesium deficiency is a very common characteristic of asthma, making sure people get adequate magnesium intake. Often we supplement with magnesium or do IV magnesium. But in terms of modulating the immune system, again, if you can stop the immune system from being so hyperreactive, you can stop allergies and you can control asthma.
Absolutely. And would you say there's a strong connection between gut dysbiosis and allergies?
Yeah, I mean, gosh, if you look at the research on gut dysbiosis, your microbiome, I think it's associated now with pretty much every chronic illness, anywhere from obesity to cardiovascular disease to allergies and asthma and eczema and everything else. So, your gut bugs play a critical role. And, that's kind of comes back to gut health and diet. I worry about people who've had, specifically early exposure to antibiotics. I mean, I look at my own life. I mean, I was an ear infection kid. I started with ear infections almost from the time I was born, and I was on a lot of antibiotics from the time I was born until I was 5. Finally had a tonsillectomy, had my adenoids removed, had the PE, pressure equalization tubes, ear tubes put in. But that early antibiotic use, no doubt changed my gut microbiome. So I think about people who've had a lot of antibiotic exposure, particularly if it's early in life. Is it possible that you've eradicated some of your gut bugs that are supposed to be there? And how easy is it to get them back? And, as much now as we've gotten our technology with PCR testing, and, you can do, these labs like Viome that do this very comprehensive stool analysis, and they can tell you every single microbe that's in there, and it's great. But I don't think we really understand what is a normal microbiome. I mean, unless you find someone that's never been exposed to antibiotics or medication, only eating a clean organic diet, I mean, you probably have to go to very remote parts of the world to find people like that. So I think our technology is a little bit ahead of our understanding of what should a normal microbiome be. And, if we do understand that, are there things that we can do to rebuild it? I mean, the things that we do know, we know that, again, diversity in food can help facilitate more diversity in your gut microbiome. So eating a diverse diet, eating a lot of, plants in particular, can be very helpful in increasing that diversity. But again, it's possible that if you've been on a lot of antibiotics, you might lost certain species that, we can't get back. But, essentially though, like I mentioned earlier, it comes down to good diet, good gut health. I think that gives your gut bugs at least the best opportunity to restore themselves, repair themselves. And again, that's sort of the foundation of all chronic illness treatment, but particularly for asthma and allergies.
One thing I've found, and I'd love to hear your opinion, is patients with high adverse childhood event scores tend to have low oxytocin and poor parasympathetic tone. So when you have them, do things to stimulate the vagus nerve, and if you can have someone write for, oxytocin nasal spray, that if they're not seeing progress with their gut health, that tends to move the needle a great deal.
Yeah, I use a fair amount of oxytocin in my practice. I work with a lot of kids with autism, and because there's so many behavioral issues, and of course, a lot of these kids have terrible gut issues. Again, it can be an effective way to help sort of calm them down, mellow them out. Yeah, anything we can do to induce the vagus nerve, get them in that more parasympathetic state. I mean, that's true. And, you're talking about ACEs, adverse childhood events. This is a thing I talk a lot about with my patients just because, trauma can be a major obstacle in getting well. And whether you've been dealing with, chronic fatigue, Lyme disease, whatever it is, there's such a common theme that I see that, this is a part that honestly most doctors aren't even talking to you about. But it's such an important part of getting well. I'm like, look, we can talk to you about diet and nutrition, and we can give you recommendations on targeted nutritional supplements. But this other piece of, big T and little t, big trauma, little trauma, often that needs to be addressed to really get to a point where your body heals. And, I've done various things in my own life to address trauma, and I'm actually doing something now that I think is really fascinating. It's a rapid eye movement technique, and it's different than
EMDR.
It's not EMDR. Yeah,
Okay.
it's I think similar in some ways, but the concept is a way of kind of again tapping into that part of the subconscious that helps move through whatever that you dealt with. I mean, obviously whatever happened, you can't change that, but we can change the way that the brain perceives these events so that it doesn't kind of hold us back and allows us again to really be at our best. But I just see that again, it's something that most practitioners don't address with folks. And so if you are living with a chronic illness and you've really been hitting a wall and you haven't addressed this, Donna Jackson Nakazawa wrote a great book called Childhood Disrupted, which I think is one of the better books out there on ACEs. And she's a journalist, a reporter, and she's got a few books out there on it, but that's the one I like. And there are lots of ways. Again, I don't consider myself a trauma expert at all. There are people out there in our community that do really great work. Keisha Ewers, Amy Apigian, Eva Detko. So there's other folks that I think specialize in this, but finding someone that can help navigate that with you can be really important.
Yeah, absolutely. And when we talk about oxytocin, have you seen it help in terms of improving parasympathetic tone?
Well, I mean, it's hard to measure parasympathetic tone. I mean, in terms, does it help people sleep better? Does it help people feel more calm? Does it help improve their digestive function? All these things that are supposed to happen when we're in our parasympathetic state. It seems so for a lot of folks. And like everything else, it's, a function of dose. So, we'll usually start people at relatively small amounts. I might start people at like 5 to 10 units. I have some people that take 40 to 60 units a day. So you just kind of have to play around with it a little bit, but there's not really a lot of downside to oxytocin. Again, it's pretty safe for most people. Again, I use it in children, I use it in adults. So just one more thing to add to the toolbox.
Absolutely. And would you say that having a strong social network, social connections, deep, meaningful relationships helps to improve the immune system and vagal tone?
I think it's built into our DNA as humans. We're here for connection. And if you look again at the research on, chronic depression and chronic, again, a lot of other things, often there is an association with lack of connection, lack of community. So it's so common for people when they are chronically ill to isolate themselves. Sometimes it's intentional, sometimes it's unintentional. But yeah, my friends invite me out. I don't feel well enough to go. I don't go to family events anymore because it's too much effort, or I'm being, gaslit by, my aunt and uncle that don't believe I really have an illness. I mean, there's a lot of reasons that this happens to people. And I think it's important to have community. And I think in the age of the internet, I mean, sometimes that's an online community. I'm still more in favor of person-to-person interaction. I'm Gen X, and I think that is more valuable to have that personal connection. But there are situations where that's not easy, or sometimes not even possible. So having some way that you can communicate with people, reach out to people, get support from people in whatever way works for you. But definitely, again, there are people who are introverts and extroverts, but I think at the end of the day, again, it's important that we have some sense of community.
Absolutely. What's something that you know today to be true that you wish you would have known 12 to 15 years ago?
Oh gosh, how much time do we have? Uh, I think the one thing I've realized is that we don't have to make things complicated. I think we as humans, we tend to complicate things way more than they need to be. And sometimes it's really simple things. I mean, something as simple as drinking water. It's amazing how much better you can feel just by drinking more water. Simple, easy, inexpensive. Sometimes we feel like, again, particularly when we're dealing with chronic illness, that we have to go for these big, expensive treatments that are invasive. And more often than not, these small things make a profound impact. So, when you're working on yourself and working on your health, again, don't feel like you have to make things really complicated. And I study with a guy named Michael Burnoff, who's, part motivational speaker, part therapist, part I'm not sure how else to describe him, but he talks about the 1% advantage. If you can make 1% difference in your life every day, it's like investment, right? You put 1 penny in a bank account. If that penny doubles every day, after a month, you have $5 million. That little
Right.
investment every day makes a difference. So we get so caught up in wanting quick change in our lives and our health and our relationships, but it's an investment, and you got to look at it that way. And just be patient with it. Do the things that are easy to do the things that are simple, and it makes a profound difference in your life.
Tell folks we're going to post the links and everything to your website, but A, what's the easiest way to find out more about you? And B, tell us a little bit about the summit you have coming up.
Sure. So the easiest way to connect with me is just on my website. It's just DarinIngelsND.com. So it's DarinIngels, N as in Nancy, D.com. And yeah, I'm hosting a allergy and asthma summit, and my co-host is Dr. Kelly McCann, who's a medical doctor and actually practices just down the road from me. Who's also a mast cell expert. So the summit's going to be free. It's going to run from March 13th through 19th. And we really want to invite as many people as possible to come listen to about 50 speakers who are all experts on allergies and asthma. And we're talking everything from hay fever to asthma to gut problems to skin problems to neuropsychiatric issues. The fact that allergies can impact so many body systems, I don't think people realize. I think people typically think of, hay fever. So again, it's a free event, and we'd love for people to come join it and share that with the friends and family that also are struggling with allergies and asthma. But we'll post a link hopefully in the show notes, and yeah, it's just going to be a great event.
Absolutely. So we'll get all that posted. And thank you so much for your time, your wealth of knowledge, and thank you for the work that you're doing.
Great. Thanks, Tim.